Good morning, ladies and gentlemen. I'm Monica Mitchell, and today I'm going to be doing a presentation on a presentation to my stakeholders on tackling obesity and stigmatization in Campbell County, Virginia. This presentation is to my stakeholders who will be funding the program. They are Virginia Department of Health, the federal government agency, CDC. The table of contents includes the segment population, leading health indicators, program overview, that is my mission, statement, objectives, and intervention, resources needed, link to behavior change theory, proposed benefit to participants and community, stakeholders involvement, conclusion, and then references. We're going to be looking at the background of Campbell County. Campbell County is located in Virginia's south-central Pardon region in the foothold of the Blue Ridge Mountain. It has an estimated population of 55,342. Female population is 28,493, and male population is 26,849. The county was ranked 24th place for adult obese among the counties in the United States. Report shows that 42.5% of the population are obese, 20% binge drink, and 18% smoke. Let's look at the leading health indicator. The leading health indicator, adult obesity is a major public health indicator associated with diseases such as type 2 diabetes, heart disease, stroke, hypertension, cancer, among others. The measure of obesity, adult obesity in BMI is greater or equal to 30. The leading causes are lack of physical activities, inaccessibility to healthy food, less or no intake of fruit or vegetable, insufficient recreational activities, etc. We're going to be looking at some health data. Adult obesity is a major public health indicator as stated before. Adult obesity ranged from 28.3% to 42.5%, which is equal to 5,700 to 23,500 of the population. Adult diabetes is 9.6%, which is equal to 5,300. High blood pressure range from 33% to 28%, which is equal to 18,000 to 21,000. Physical inactivity is approximately 25,000, which is like 13,000. Adult smoking is 18.6%, which is 10,000. We're going to be looking at the segmentation of adult obesity population. So for our segmentation, we're going to be looking at the young adult ages 18 to 35, middle age adult 36 to 55, older adult ages 56 and above, adult with low income, inactive, motionless adult, obese adult. Program overview. Our program overview, we're going to be looking at our mission statement. to remove the stigmatization of obesity and promote healthy living through education and behavior change with support of families and community. The goal is the goal for this program is within 2 years, launch and maintain a healthcare community campaign that delivers at least two stigma-reducing obesity messaging per week through social media platforms. That is Facebook, Instagram, TikTok, reaching at least 500 community participants. The program objective is in the period of 2 years, create public health social media communication channel, which is Facebook, Instagram, and TikTok, in the first week to disseminate obesity-related information to 50 obese patients. Post at least 2 messages per week within the next 3 weeks. So let's look at our intervention strategies. One is healthcare providers training. That is from 1 month to 1 to 3 months. Train providers on respectful languages, weight loss awareness, and patient-centeredness. 2, community education program for month 3 to 6. Facilitate public health campaign via social media, workshop, flyers, and etc. 3, strong team, a strong support team. So for the next 4 to 8 months, we create support group for participants. 4, community-based anti-stigma education. That will be done in 5 to 10 months. Launch positive body and anti-bullying in the community. 5, behavior counseling training. For the next 4 to 12 months, train on stress management, self-esteem, nutrition, physical activity, and healthy life. For 6, media and advocacy program will be the next month. It will last for 6 to 12 months. Encourage non-stigmatizing message and obesity language in healthcare and media. 7, policy and environmental support for this program. So the month we will do that in 8 to 12 months. Champion policy that improve access to healthy food, physical activities, and equal healthcare access. Now let's look at resources needed for this program. We have personnel resources such as program manager, nurses, physicians, dietitians, psychologists, health educators, social workers, media coordinator, content creator, graphic designers, financial management and manager, IT specialists, volunteers, community leaders. For more of the resources needed, we're going to be looking at the curriculum or instructional resources, obesity, stigma training lessons, educational material, video, podcasts, and webinar online learning and toolkits, presentation on nutritional food, menu tips, and recreational materials. Then we're looking at the space or facility. Some of the facilities that will be used will be office space, community center, community clinic, churches, town hall, and fitness center. And also we need equipment and supplies. So we're looking at desktop, laptop, projector, Wi-Fi, microphones, notepad, pen, exercise material and educational magazines, financial resources. So we need financial resources for our staff, for the staffing costs, rental training material costs, technology, transportations, flyer, etc. And then of course we have to have the community involved. So we say community participation. So we have Campbell County leadership, Virginia Department of Health, CDC, federal government, community farmers, local businesses, hospitals, and clinics. And evaluation resources is the survey, assessment tools, data collection software, evaluation officers, among others. So then we're going to be looking at the social connective theory. The social connective theory focuses on 5 key areas for obesity stigmatization. We have observational learning. Participants watch videos and share test and transformational testimonies that display courtesy to obesity population. Self-efficacy, train and healthcare workers and community residents in using non-judgmental languages. Reinforcement, receive constructive feedback and digital interactions that encourage respectful behavior. 4, behavior capacity. Share educational posts that are factual and realistic on genetic impact, environmental effects, and social influences on obesity. 5, environment. Maximize social media platforms to enhance positive environment that decrease obesity stigmatization. Let's look at our proposed benefits. Our proposed benefits for this program they are promote healthy lifestyle changes, reduce the risks of obesity and related diseases, provide public health awareness on impact of obesity stigma, decrease weight biases and discrimination, increase access to health education, provide mutual support, and enhance physical activities. Our stakeholders' involvement. Our audience are the Virginia Department of Health and federal agency CDC. They will provide us funding. Our funding source they will provide us the funding source of they will provide us funding such as grant for obesity programs, provide public health experts to facilitate training, ensure compliance with state and federal laws, do evaluation or follow-up on programs, receive final report for program implementation. In conclusion, tackling obesity in Campbell County, Virginia is an urgent public health need that must be addressed. Epidemiological data shows a direct relationship between obesity, stigmatization, and its-related illnesses. Urgent intervention is needed to save the adult population, the obese population. State and federal funding grant is needed to support the proposed program. The program will mitigate the health risks, encourage lifestyle behavior changes, restore dignity, and build self-esteem in the priority population. Thank you so much.